What you trying to sneak peek on my paper for?
I can't see that.
She don't have her glasses on, sir.
I can't see that.
I want to go to MP school, and I was like, maybe if I do go to the floor, I'll be able to slow down and learn the disease process more and get to actually follow a patient, see how they progress and whatnot.
It doesn't matter what you say that rhythm is. They're not going to take your word for it. You can know that rhythm till you turn green. They still going to ask the cardiologist to come look at it.
Oh, okay.
So you just know it for the benefit of knowing, but they don't care what you think that rhythm is.
Because that's not their specialty.
Yeah. So you like the babies, you like the old people.
I love old people.
Do you?
Especially when they're demented and they're just rude. Oh God.
I don't have the patience for
I
it.
just like what they just abuse me verbally.
Oh no.
Yeah. Say what you're gonna say.
No, ma'am.
I used to actually go, when I first started, I used to write their medications out. And I used to stand there like, okay, what is this? What is that? Because I was nervous. I was like, I don't want to go in here and practice the name. Because you don't want to go in there and they be like, what you just say? And you're like, I don't know.
I just can't deal with people like, you know, those
The
people with the
flaky
flaky
skin.
skin.
Yeah.
Like,
I do. When you put the tourniquet
I'll
on,
be doing this all the time.
I think pediatrics is just my background. It's what I have the most
And
experience
how do you
with.
stick a kid with a needle?
easy.
Easy. Well, because you know it's helping them. You're not doing it to hurt them. You know this gonna help. This is gonna help you.
Let me slow down when I got you here, and then we can pick up the pace in between and slow down when I got this other one, and just being able to communicate with them, saying, okay, look, this is your triage process. We're gonna get this blood. Tell them the things that are happening behind the scenes, so that when they're sitting out there, they don't feel like we just pushed them back out there again. So that was my lesson for me.
Talk your shift, voice it loud, break the hush in the crowd. Say what they don't say, truth in the shade, stand proud. Real talk, no disguise, streets whisper, no lies. Real shift, real fight, another light, no disguise. Talk your shit, speak your mind.
All right, how's everybody doing?
Everybody is good.
Everything is everything.
Did you go to the gym today?
I did not.
You're not planning to go to the gym?
Nope, not
Well,
today. Maybe tomorrow.
Well, I don't want to hear you talk about
Ask her tomorrow. Nope, not today. Maybe
You
tomorrow.
shut up because you can't jump.
No, I'm gonna start going to the gym. Come on, Donna, let's go.
I'm gonna do yoga and Pilates.
Yeah.
I'm on my soft girl era right now.
That is soft girl gym though.
I did burn boot camp, and I'm gonna do it soft this time. Give me some yoga and some Pilates.
Okay.
You know.
I hear Pilates is really that though.
Yeah. I tried it and I was like, this shit ain't no joke.
Yeah. Y'all thought it was easy. With them old people be getting it though.
Yeah.
I have
I
my
gotta be.
thing.
I need to be flexible.
So will you go into the gym
To do what?
to work out?
I got it in my garage. I have a whole little setup in there. It's too hot in there now though.
Yeah, it is.
We having a heat advisory.
About what?
What? The heat? The heat advisory. They texted my phone.
Okay. So, what's this? What we talking about this week?
So tonight's episode is more so like a freestyle, and us just talking about like new grad nurses, and like helping them,
Okay.
and like for them not to give up,
True.
you know?
Well, you know the hospitals, they say there is a nursing shortage, right? But what's the real problem? Why are we losing new grads? Like, I've met so many new nurses, and I also seen it on social media where they're not even 6 months into their residency program, and some of them like literally quit. Like, I see this one girl sitting in her car, like as soon
You
as
seen it?
Yeah.
Okay.
We're sitting in her car crying after a shift because she's like, she thinks she made a mistake. Like, it's a lot, you know? Nursing is a lot.
I have a comment about that.
Okay.
I feel like social media has romanticized nursing and made it look like it's such an easy job that you don't really need to do a whole lot to do it. Just get through school, pass your NCLEX, and you can nurse. But it's way more to it than that. These people come in there with unmanaged disease processes,
Speak
no
your girl.
insurance,
Talk
no way to follow up on things that require a specialist. And they are not prepared for that. They think they can come in there with their little cute badge reels and their little bog bags and their cute little Crocs and tight ass scrubs. It's more to it than that. You got to be prepared.
Preach,
and I
sister.
think that's why they leaving bedside, because they wasn't ready.
True. So
And they're not getting their luxury cars right off with the first paycheck.
Yeah, because you got to build up to them damn paychecks.
You do.
Yeah.
So y'all feel like most or some of these nurses that are quitting right away, you feel like they are choosing it for more of
Aesthetics.
job security or money or just...
Well, it just depends, because it just depends on the kind of nurses, because you do have the new grad nurses that are still crying in the car because they feel like they just can't get the job right, because they're getting cussed out by family members. They're trying to get help from their charge nurse, but the charge nurse is too busy, or she telling you to get another coworker, and then it's like, okay, well, dang, nobody wants to help me. Then you got the doctors coming around asking you questions about their patient, and you like... Broski, I just got on my own yesterday. Like, I don't know. Wait a minute, you know? So I do think that it's like a lot of nurses that need help with that. Mm-hmm. But then there's some that, baby, they had their lashes be long. I'm like, how can you see?
Yeah.
You know, nails long, you know? I'm not doing no more.
Yeah.
I do miss my nails though.
I miss mine too, but I refuse.
Me too. And then they like, if you have them on, you're going across the street to get them removed. Like,
What's across the street?
a nail shop.
If I go to the nail shop
It's a
to
nail
get them
shop.
removed, I'm not coming back because I need my toenails removed too.
Yeah, it's a nail shop.
Then you're
And a
not
foot
gonna get paid for
massage.
that day.
You know, hey.
Yeah. So, you know, I think it's different things.
Yeah, I do think though, the reality of nursing, it does shock some new grads because even me, like I had experience working bedside as a paramedic, but nursing is a different beast. Like I never had to encounter with doctors as much as I encounter with doctors writing as a nurse. There you like the what you call it, the liability that comes with it, you know, it's just scary, and they just make it scary too, because it's like if you slip, you slide. Like it's just, they make it just seems like it's just so easy to mess up. Coming off now, I'm more comfortable because now I learn that it's not so. But I feel like a lot of these new grads too, they're not giving it enough time. Like some of them are timid, some of them are just scared, and it's just how they, you know, it's just how they, I don't know.
And I don't care how well you performed in school. You could have been the valedictorian of the class. That book and that patient are not the same.
things.
Sometimes you do get classic textbook symptoms, you know, but sometimes for the most part, no, because that asthma attack don't look like that one, don't look like that one. So you got to understand it. Yeah, you definitely got to give yourself time, because you got people faking seizures just to get some benzos.
Yeah,
And you got to be able to say, you know what,
that's not a seizure.
this not a seizure.
You
The
gotta-
new grad might be like, oh my God, they're having a seizure. No, they just act very well. So
they need a Grammy.
Yeah. Yeah.
but it's gonna come with time. So the new people that's out there, the new nurses, just stick in there, and in your free
If
time.
you really want to do
Yeah.
nursing, like if you gotta have a passion for it,
That part.
you gotta be something that you really want to do.
Yeah.
It
Not
can't-
because your grandpa, grandma, sister-in-law, baby cousin
Yeah.
them
You
told
know, or
you.
not because you were forced into it because by your parents to be like, oh, you gotta be a nurse, or your friend is a nurse, you know, or you see nurses that's been years in their career driving their big fat Mercedes and, you know, doing all the things. You know, nursing doesn't happen overnight, and they need to start telling them that. Like all these nurses that, you know, showing their success and social media, you know, I'm happy for them, but
Yeah.
I feel like they kind of fooling
Yeah,
people,
for sure.
you know, and
sure.
they are deceiving, going into nursing expecting, hey, as soon as I get my first paycheck, I'm gonna be able to buy my, you know,
Yeah, that's-
mansion
yeah.
and all of that. Like
Well,
you said, Isis.
No, seriously, it would make you think that you're behind as a new nurse. and you see these other nurses, it'll make you really feel like, oh my God, why this ain't done? Why I sit right here? Why this? You know, like.
And that just goes to show you in it for the wrong reasons if you're watching me like that.
Yeah. So.
And you definitely got to keep learning. You
always have to keep
You got to take notes of the things that were challenging to you and go back and make sure that you understand what you saw, what you did, what medicine was that, what disease was that. Yeah. Keep learning.
It's like never ending. You always gonna learn something day by day. Especially when you really sit down and you read in them charts, you're really going to understand, that's why this is making sense. Like, that makes sense. This is why they doing this. This why this doctor's on board, you know? So.
And be okay asking questions, because I've gone to doctors several times, like, why are you giving this? And they came in for that. And I didn't know the medicine worked for this reason. Or, why are you ordering this when it's that? Or, you know, I asked questions.
I had that
I like to ask
situation,
questions.
My last shift, like, the patient was admitted, and they were ordered Keppra. So now I'm doing
seizure.
No, admission order. Like, they're supposed to be on the floor by this point, but there's no bed available. So I'm doing like their daily meds kind of thing. So I went in there with Keppra, and I'm like, hey, I got Keppra for you, and I think I had a blood pressure medicine for her as well. And she's like, oh, I don't take that blood pressure medicine in the morning. I take it at night. But what's that other medicine you're giving me? So I said, Keppra, you know, for your seizure. She's like, I don't have seizure. Immediately, I was like, let me go find out what why the doctor is giving you this medicine, and, you know, because I don't know the reason why the doctor is giving it. You know, I don't know if it can be treated for something else. I don't know much about Keppra. So, but I do know it for seizure. So I went and I asked the doctor, patient want to know why they're getting Keppra. You understand? It was prophylactic seizure because she had fall, she had amnesia, she didn't remember how she fall, yada yada yada. So all her symptoms was leading to seizure. So the doctor is like, oh, just tell her that it's we're just teaching her prophylaxis for seizure, and once she talked to neuro, they'll decide if they want to keep her on it or whatnot. So stuff like that, you know. I feel like we do learn every day, and you gotta ask questions like. One thing you got to practice, and I will tell any new grad this, whatever medication you're giving to the patient, just look it over on the MAR first before you go in there, because even if you don't know it, try and pronounce it. Look, you know, so
know both names.
Know both names. So when you go in the room, actually you can be like, hey, I'm giving you your lisinopril, I'm giving you your Keppra, yada yada yada, you know. So the patient, most of them will be able to tell you, just like this lady was able to tell me, oh, I don't take that. Don't just pop pills, put it in a cup, and give it to patients, you know, because sometimes doctors do order. We all humans, they do order. They have a ton of patients, just like we do. And sometimes they do put in the wrong order on the wrong patient, you know. So that's why we have to double check and got their backs, you know, and hope they got ours too, you know. But that's it, like, ask questions, you know.
I used to actually go, when I first started, I used to write their medications out. And I used to stand there like, okay, what is this? What is that? Because I was nervous. I was like, I don't want to go here and practice the name. Because you don't want to go in there and be like, what you just say? And you're like, I don't know. So I think that is,
it's good practice.
Yeah. That and time management, like, really, like, in your 12 hours, do what you need to do. Like, get it done. Because it's the worst thing is to be there for 12 hours and then the day shift nurses come and you like, so yeah, this is all I got from this patient, you know, or this is all I know. And it's like, you got to dig in these charts. You have to dig.
Yeah.
And
it's definitely each one teach one.
True.
For sure.
Yeah.
But I think that I don't know, you guys. I don't know. I've been watching, like, in the last few weeks, when I was saying the last few weeks, I just been watching, like, night shift new grad nurses, and they need help. Like, they need peers, like, even if it's not an every week thing, at least a once a month, just to check in, how you doing, are you struggling with anything, just to, like, help them.
Like a mentor kind of.
Yeah, because they really think, like, they really be overwhelmed. Like, I felt so bad for one. She even cried. I felt bad for another one the other night because it was just like blow after blow after blow. She's like, I knew I should have just called out. And I was like, oh.
But guess what? This day is going to repeat itself several times over.
Yeah,
so you need to get used to it.
And it's not going to break you. You have to keep going. Like, you're going to have those days. You got to keep going.
So what y'all think? I mean, this just popped in my head. What if new grads, okay, you know how we all have our uniform colors. It's that blue color, right?
Navy blue. Mm-hmm.
Okay, let's say the new grads have to wear a slightly different color blue so that they can be identified among the peers and doctors to know, okay, this is a new grad, let me be gentle with this one. And then you kind of have stronger nurses around you, but until you get off of that new grad orientation, you should be in a certain color so we can identify you.
They got it on their badge. They don't have it on their badge.
I don't know, I don't pay attention to that. I need something a little bit more bigger than that.
No, they don't have it on their badge.
That's
it just
crazy
says nurse.
because okay, so like the doctor residents, it says residents on their badge. New
does.
Grad at where I work, it say new grad
on their badge.
Yes.
Ours don't do that.
I told you we might need to go.
Ours don't. We
might need to go.
Yeah, it don't do that. But
oh, y'all fancy out there. Y'all got money. Like an hour. We can
carpool.
We can carpool. Y'all
Don't
fancy out there.
Yeah, that's nice. But no, we don't have those indicators.
We don't have those yet.
Okay.
Yeah. Not yet. It ain't gonna happen.
It
ain't gonna happen.
Oh, okay. Well, we might not.
But you know, all of us at some point was a new nurse. Every one of us. So why there's not more teaching going on?
You know what really grind my gears?
Please tell me.
Please enlighten
nurses who talk shit on new grads when they see them on the floor, or like act like oh, she's so, are they so, how did they become
it's
a nurse?
It's not clicking. How many times I got to tell
Not
them?
remembering.
Y'all see that?
Yes, they were once a new grad too.
Yeah.
Somebody trained you.
Yep. You didn't come out there just knowing this shit.
And one time I had to check one nurse, like, you can't be doing that.
Yep.
Like.
Really?
Yep.
And it was this new grad. Honestly, I don't know how they're going to get through this in their career, or if they're ever going to get over it. But I don't know how you made it all the way through nursing school, and every time you see blood you faint. So he was assisting in putting in an IV with his trainee or trainer, and nobody knew what happened. He just fainted. So the patient was sitting in the chair by the bed while they were doing the IV, and they called a rapid, so we thought it was on the patient.
It's on the nurse.
When we go in the room, the new grad was laying in the patient's bed. When he finally come around,
I'm sorry.
I'm serious.
Was this at our place?
No.
Oh.
When he finally came around and we asked him what happened, then he tell us the story that every time if he sees blood, he faints. So
it's gonna be a long
I
journey.
was like,
the journey has started long.
I was like to myself, like, how did he make it this far? And
you don't see blood in nursing school for real.
You don't see blood in nursing school? I used to see blood in nursing school.
On what?
Clinicals.
It depends on what school you go to, because they be putting people in nursing homes. I don't see shit over there.
True, but
you'll see some nasty wounds though, baby.
Yeah.
So they were talking mad crap about him, and I get why they were talking crap
he
about
better
him.
Get it
he got to tighten up. Like, what you mean you scared to see blood and you in the whole healthcare?
He can't help it. He's fainted.
Yeah, he might have to take another career.
Like literally laying in the patient's bed.
Not laying. Where's the patient at?
In the chair.
Get out!
They were starting his IV in his chair, and he passed out, and his trainee picked him up and put him in the patient bed. I almost died.
First of all, don't put me in the patient's bed. Don't care what we doing. Don't put me in the patient's bed.
I mean, you're passing out.
Y'all make me want to go into emergency.
Come on.
Like, y'all really do. Like, but I don't know.
I tell you what, no 2 days will be the same.
I know. Y'all
It's
make me want to go
time.
into the ER.
Do it. Do it.
I don't know about where I'm at, though, if I was to go into the ER.
You gotta
Yeah, and the guy.
Give us some time. I'll tell you when it's safe.
Okay,
It's not safe right now.
it's not safe right now.
Not right now.
Okay,
They still remodeling.
okay.
Yeah. Some people created some mess around there.
Okay, they
you know,
still remodeling. I'm picking up what you're putting down.
I reckon Ball went through
I don't
that.
know though. I kind of thinking about going into cardiac.
I say do whatever.
I think I'm gonna
Do
try
it.
the cardiac.
I say
floor.
venture out
Do
to
it.
whatever. Like don't
You won't know until you try.
Yeah.
Like for me, I was miserable on cardiac. I wanted to
So
quit.
is it because you had to be in telemetry? Because I want to learn my rhythms.
I just hate
Go
being
watch some YouTube videos.
That's not easy
Listen to-
money.
What?
Telemetry.
It ain't no
No.
different.
Oh. I thought, well, hold on, because I'm thinking of different.
First of
I'm
all-
thinking of telemetry in the room.
Okay, here's
Is
the
that
thing.
wrong?
It doesn't matter what you say that rhythm is. They're not going to take your word for it. You can know that rhythm till you turn green. They still going to ask the cardiologist to come look at it.
Oh.
So you just know it for the benefit of knowing. But
Yeah.
they don't care what you think that rhythm
Because
is.
that's not their specialty.
Yeah. So, no, you don't. I don't.
Oh,
I don't
but
know
if it
you
was
get
my
paid.
specialty.
What? It don't matter.
Oh.
You're not a doctor.
Well,
don't
no,
have to
I
know
don't want.
something.
I just want to know for myself.
Okay.
They
YouTube. I
Just
don't know.
self-educate.
I don't know. I have that on my vision board
Okay, it's just self-educate. It's
of
not
being
that
a
bad.
in
just
cardiology.
self-educate. If that's the only reason why you're gonna go to cardiology.
Well, that's not one reason, but I just want. That's something that I'm interested in knowing. I don't feel like we spent enough time on that, and I need to know how this heart is working and all this fun jazz. Like I get excited about that.
Yeah.
Like bundle branches and.
Yeah, like them is like them. They're homegirls to me. AV No and all them SA
Yeah.
No. Yeah, they're homegirls and stuff.
Yeah.
Let me tell you about Will though.
Really, that's
Will is the
exciting
type
to
of
know.
person. I think if I had to say what he didn't like, if they say your friend, answer for your friend. My friend enjoys the dialogue with patients that can talk back to them. Okay, his patients that are up in that department are sedated and intubated. They can't refuse nothing. They can't argue with him. They can't give him no shit. He likes that. He likes the banter and the just, you know, the different personalities that you encounter in the emergency room. Up there, the only people talking you dealing with is your coworkers. And we don't like people like that.
Oh, so y'all don't. Okay.
The patient ain't talking, and you got to talk to their goddamn family members. We don't want to talk to them.
I want to be able to tell you why you wait till your blood pressure is 200 and over.
Yes.
Some
It's
of
the banter he
190 to
like.
come here.
Yeah, why you wait so long?
I'll be like, I want to be able to tell you, you keep this up, you're gonna be able to walk like this.
That's what you be telling us?
Same way.
Oh, yeah.
Because you got to tell them like it is.
Yeah.
Oh, wow.
Why are you not following up with
ED
your
is a-
primary
is a
care? Why are you
different
not
beast.
taking your blood pressure medicine? You know?
Then you ain't here cussing us out because you going through all this.
Yeah, exactly.
And you just
Okay.
give it back to them. I mean, not everybody can get disrespectful, but we gonna give it back to you like you gave it to us.
Oh, all right.
For sure.
Okay, so that's the life in the ER.
You know,
Yeah,
I've never met
it's
a patient
entertainment.
that tell me, like, made a complaint on me, say that I'm rude
Right.
or whatnot. Because you gotta feel people's energy, and and before you even try to, I'm not gonna walk in a room, don't even introduce myself, or try to feel you. I'll have a conversation with you before I start cracking jokes or say, saying
for
stuff
sure.
that probably shouldn't be saying that's gonna get me in trouble. I gotta feel you out first.
Yeah.
And if I'm gonna match your energy, I'm
Yeah.
gonna match your energy, But if I see you're not that kind, okay, I'll
I'ma
give
keep
you.
it
I'll
moving.
keep it
Business.
professional, straight business. You
Yeah.
straight business, we straight business.
Okay.
But if I see you somebody I can be like banter with and go back and forth with, we're gonna do that and get
Oh,
through the
yeah.
shift. You're gonna feel better, and I'm gonna be
Yep.
happy in my shift.
Yeah.
So,
And they
Because
gonna be
you
like,
did
what's
what you
your
had to
name
do."
again? Thank you so much. They appreciate that because that I think
Y'all
that
got
people
me, got me thinking.
when they come to the emergency room, I think they already in their mind, they know they gonna wait a hell of a long time. They probably think they're gonna get a shitty nurse who don't know what they doing. The doctor ain't gonna listen to them, so they already got their little
Negative thought.
expectations coming in. But when you encounter a nurse that's like, what's going on with you? Like, talk to you like you somebody. Take the time and listen.
Talk to you like you're normal.
Yeah,
Exactly.
they appreciate
especially
that.
if they've been sitting out there for hours and then they just got back there to a room. They don't want nobody giving them no attitude because trust me, they already have an attitude for out there. And if they come and they're giving you an attitude, you just have to try and
Yeah,
soften them
say, hey,
up and
listen.
try and redirect them. Like, hey, I just work here just like you came to visit here. And like, it's true. Like, I wish The wait time was shorter. You know, I wish there was something I could do to make you get back here faster. But hey, I just have to wait till the bed open. We got one right here, so we're gonna get this done. You know what I mean?
Yep.
Like,
So what would y'all tell y'all new grad nurses that wants to go straight to the ER? Do you feel like they need experience somewhere else or just jump in?
You're gonna learn
no,
every day.
like
something.
if you feel like, again, I keep saying this. If you feel like that's your passion, go right into it. Like if somebody gonna hire you directly in their ER, take the job. If you said that's what you want to do, and if you go there and you feel like it's too much and that's not what you want to do, try another specialty.
Yeah.
Just keep trying different specialty until you find the one that fits you. You know,
Right.
you never know.
That makes sense. Okay.
I don't think I'd work in any other department.
No.
I don't think I can ever work in any other department.
I need all
But
that.
do you think y'all are like that also because of y'all's like being paramedics and stuff? Like y'all was already in the streets, y'all was having fun with that. Then you got to the ER and I was like, oh yeah, it's up in here.
Maybe we've been doing it for too long and it's just so hard. But I did went to the floor with a hope in mind to say, because you know I want to go to MP school, and I was like, maybe if I do go to the floor, I'll be able to slow down and learn the disease process more and get to actually follow a patient, see how they progress and whatnot.
So when you become an MP, where are you going? When you become an MP, where are you going?
Acute care.
Acute care.
Yeah.
Okay.
Yeah.
Okay.
I either gonna do urgent care or ER.
Or both.
Or both.
Yeah.
Both sounds cool.
Yeah.
I remember our nurse practitioner out in out the urgent care. She was cool.
Which one?
Well, I didn't know if I should say her name or not. She was the black one.
Girl.
Drink to that.
She was.
Here's to no names.
You remember? You remember the white one?
Oh God.
See,
She
you
used to
know
work
exactly
she
who
used to
you
work
know
in the-
exactly who I'm talking about. In that one.
Because me and her couldn't get along. Remember?
I wonder why.
Because she always asking me to do shit that I'm out of my scope.
Always. And then when she come in, she'll just be like, so what do we got? What do we got? What do we got? And we're like,
This woman asked me to go numb a patient laceration with lidocaine till she gets in the room. I said, what?
she's like, well, I'm an ER nurse. No, she was an
Like
ER
NP.
NP. Yeah. I'm an ER NP, and we just do things certain. I'm like, girl,
That is not. No, ma'am.
that was.
I don't care how you do it. That's a no, ma'am.
Yeah. But okay. So where you going when you get your NP?
I'm gonna do the same.
You gonna stay
Same
where?
thing.
Okay.
But I think I want to take a different approach. I'm gonna do the FNP with the mental health
Okay, so you're deciding mental
combo.
health. Okay.
I don't want to do only mental
But
health.
you're gonna come. Well, I
But
know
I
the last
definitely-
week you was like, I don't know.
I'm
'cause
definitely.
I
It's gonna be
kinda
some
like
mental health in
it.
there for
Okay.
sure, some kind of way. But I want to be able to have both options. So
Okay.
if I would go to a private practice or whatever, I can then be the one to see their psych patients
Right.
or their mental whatever.
Yeah.
Because you can't. Everybody can't prescribe those medications.
For sure.
So I'll be that person.
Okay.
Maintain their little drugs.
I think I'm going to go to peds. I'm gonna be a pediatric.
Good luck and God
Yeah.
bless you.
I think pediatric. Like you said, FNP.
How do you work with kids and you have so many kids?
That's why I can work with them.
No,
I got the
because
patience for them.
It does something to me. Like this kid came in the other day, and we have a pediatric unit anyway in the ED.
They got their own side?
Yes, they have their own side.
So we don't see
need
kids
that.
at all.
This is sounding better and better every time I talk
Yes.
to him. Okay, go ahead.
So we don't see kids at all at the main ER. And the dad brought her in wrapped in a towel, and like she was going down the slide in the backyard, and she cut something. She was bleeding on their back and something. And as soon as I see that little girl, I remember Lexi, and then I'm like, oh, I can't deal with kids. Like she's crying, she's hurting. Like I'll feel like I'll be too nervous. I'll screw something up.
No, I think they're
I
just
can't
little
deal
people.
with kids when they're hurting.
Okay.
Yeah, no,
Don't bother me.
I think pediatrics is just my background. It's what I have the most
And
experience
how do you
with.
stick a kid with a needle?
Easy.
Easy. Well, because it's helping them. You're not doing it to hurt them. This gonna help. This is gonna help you.
No,
Yeah,
I can't do
pediatrics
that.
is that's
Shit.
my stuff. And I think
Some of them kids surprise you.
you
with
can
them
talk
IVs,
to
though.
them. You have time to talk to them. So that way when they get to the people that's coming into the ER, hopefully you don't talk to enough of the kids that it could prevent some stuff for some of them. It ain't going to be all of them, but majority of them is the goal. So if I can talk to them while they're young and stay with them from newborn and up, that's cool for me.
Y'all can have that.
I don't want that. You
will.
can have that.
I'll take it. I'll take it. Yeah, I'll take it.
So you like the babies, you like the old people.
I love old people.
Do you?
Especially when they're demented and they're just rude. Oh God.
I don't have the patience for
I
it.
just like what they just abuse me verbally.
Oh no.
Yeah. Say what you're going to say.
No, ma'am.
Cause they're allowed. They're allowed to do it. Like I just love it.
Their honesty, basically.
Like, you're not fucking touching me with that. Yes, I am.
One lady's like, you
can't.
take it your damn self.
Yeah.
I'm like, no, you won't take it. No, you take it your damn self.
Do you ever have them when they keep calling you a family member? I just answer and pretend
Yeah,
I'm
I
the
just
family.
talk to them normal. But my grandmother had dementia, so I'm used to it.
Give me the same people. The ones that know what's going on. Give me them.
So
Not
you
the
like
babies, not the old people.
just the middle age.
Give me all the middle-aged people.
I
Okay,
love geriatric.
And a few psych
We got
people.
something. See,
Throw
we
me
got
some
something
crazies
going
in
on.
there
We got
and I'm
something
good.
going on.
I think we got the whole world covered now.
Yeah, yeah,
so.
I think so.
My favorite patients are geriatric patients.
Mine are pediatrics, but I wouldn't mind working in like family medicine. I'll be a primary doctor.
What's your
nurse
least favorite
practitioner.
patients?
My least? Don't give me a seawall, period.
Really?
What about
Yeah.
you, Donna?
My least favorite? Let me dig in my Rolodex and see what.
Mine is teenage girls. They just always have an attitude.
You know what? They just need to be talked to. It's like,
They
give
just
them
always.
business sometimes.
You be talking to them. They be down in their phone. Do you wanna? For what?
what they be saying?
Just for what? Like, then the mama or the daddy have to be like, get out the phone. I'm like, these teenage girls, they just, I don't know, it's just something they go through. But I guess I'll learn because I got one coming.
Yeah. You gonna learn. You gonna find out.
Yes, you will. Yes, you will. I don't like the nursing home. I'm sorry, y'all.
I like nursing
I'm sorry,
homes.
but when I see an old person on the stretcher waiting to go into a room by EMS, I swing by and be like, hey, where y'all get them from? And if they say the famous ones that I know of, I'll be like, shit.
Yeah, some of these nursing
Because
homes,
you
once
already
you
know-
I heard one
name.
nursing home was really. I remember having a patient's wound was so bad, and I remember this nursing home, and I was just like, I don't ever want to go there.
I don't want to go to a nursing home, period. Take me
No,
out.
not to live. I'm talking about to
I don't
like
want to work at one or
I'm
go
gonna
to
work
one.
at one. I'm gonna grab me a shift. I'm gonna do that.
I would never.
I like geriatric patient, but I
Faithfully.
can't do the nursing home because ain't no way I'm taking care of 30 patients.
Yeah, you is.
I don't want to be nowhere near in any of them. Even as a paramedic, I
I'll
hated
be
running
in
calls in there. It's
I'll be
depressing.
in there. No, it's not. It depends on how you look at it.
What's your least favorite procedure to do? Or what are you not looking forward to do?
Catheters.
Anything with the eyeballs.
Okay.
I just can't do eyeballs. Like Morgan's lens or Wood's lamps. I'm going to start crying because my eyes are watering trying to do whatever you need done. I can't do it.
What about you, Isis?
Catheters. I don't
Ca-
like doing catheters.
Foley catheters?
I don't like doing none of it.
What's your favorite thing to do?
So far ports,
Okay.
like
What's your
accessing
favorite?
them, but I get nervous because they're so like. I get nervous, but I like them a lot.
Okay.
I like them.
What's your favorite thing to do?
The thing that no other nurse can do,
What?
whatever it is.
Oh, so you
Like
want,
if
you want to
I-
have a
I
one-up
wanna-
on everybody
Yeah, I do.
all the
I do.
time.
Okay.
I can't get that line. And I've tried 4 times. Let me try.
Okay.
It's just, I don't know, it's gratifying. Whatever you can't do, I want to try to do it.
Gotcha.
Yeah, that's my favorite thing.
I don't like skin. Like if you're scaly and your skin is just shedding, I gotta switch you. I'm sorry. Like
Not switch.
I do anything else. I just can't deal with if your skin is shedding. Probably gonna put on a hazmat suit to go in there because I can't do it. That's just my thing. Like I can't deal
You think
with
it's going
that.
to get in your nose or your mouth?
Or something.
So
like,
do you dress all the way up when you do see their skin?
I didn't do it.
Oh.
I said I will.
Oh.
If I have to, but because I just can't deal with people like, you know, those
The
people with the flaky
skin.
skins.
Yeah,
like,
yeah.
I do. When you put the tourniquet
I'll
on
be
it,
doing this all the time.
and you pop the tourniquet off,
Or
and
if
it
I
got little
breathe, it's
flakes.
going to be in my
Can you
nose.
please have on a mask before you go in there? Because if you're spitting out their skin, it's a problem.
So that's my least favorite thing. My favorite thing to do is NG tubes. Woo.
Really?
Mm-hmm.
No, I don't like NG
Let me just
tubes.
lube that up and slide it in.
No.
Oh.
Cut that out.
No, please keep it. We gotta keep that.
I am not.
Ew.
Love it. Ain't no you. That's great. I'm for it. I'm for all of that.
And I'll drink to that.
Please move it up and slide it
And
in.
you got to repeat that, didn't you?
Yeah, no, I don't like
We are
NG
talking
tubes.
about an NG tube. Remember that guy who got in trouble for sexualizing that Foley?
whatever.
Let's not be that.
Well, we're not doing half the stuff he was doing. Not even a little bit. Shit. No.
Now, how you do your NG tubes again? I'm just playing. Go ahead.
No, NG tubes.
I tell him to tuck their chin and push it down. That's it. That still didn't sound right. Let me just shut up.
And that's one glass of wine.
That still didn't sound right.
That's your favorite, though. Okay. I haven't started my my nursing residency yet, so
When do you start?
July 20th.
Okay.
So I'll be in the thick of it here soon. And then I can't tell anybody, well, let me go get your nurse.
Yeah, you're the nurse.
Yeah.
I liked residency school. Will didn't like it.
No.
Only because of what you did.
No, what I did.
You went to the other side.
No, I just don't like sitting in a classroom.
So, but you did finish it though, right? Mm-hmm. Oh, okay. Where you're at now? Mm-hmm. Oh, okay.
Yeah. And I'll never do it again.
No, I liked residency school. I think that helps.
I'm not saying
that
it
helps.
didn't help. I just said I didn't like it.
No, I'm saying I think that it helps with like new grad nurses.
It does.
Some of the seminars help. I thought so anyway. For me, for me it helped.
Yeah, they got some good stuff. They taught us some good stuff. I still hated it.
But there were some days I was in there. I'm ready to go home.
Yeah.
Go to sleep. I
Yeah.
was pregnant and hungry. Oh.
All right, we've reached the segment where we talk our shift.
Or talk our shit.
Yeah.
Or talk our shit, yeah.
So, did you work this weekend?
I did work this weekend. It was a good weekend for me. It was a good weekend.
Did you learn anything from anything? Does that make sense?
Yeah, I think that we should stop giving out PCA pumps for patients that know that they can come to our hospital and get it. It's freaking addictive to these younger kids. It's so powerful, it's so strong, and I wish that it would not be given every time a patient has a sickle cell crisis.
Okay.
Because they're coming in, they're cussing us out, they're mad because the orders are not put in. Now we're calling doctors. It's just a lot that goes with that. And
Those patients are hard to deal with.
They're very hard. I think it's very hard to deal with that. So that was my weekend overall, though. And that's it.
Any personal lessons that you can attribute to life in your movements?
Yeah, I got to start going to the gym.
Oh, okay.
I got to get on my healthy stuff, my healthy journey.
Less of this and more of this.
Yeah, so I got to get on my journey.
Okay.
Yeah.
Okay. How about you?
I did work. I had pretty smooth shifts for the most part. I was in intake twice. So that whole triage after triage after triage, that cycle of endless patients. What I did learn though was just slow down. And not because I'm rushing, but when you slow down and you give that person in front of you that little moment in time to get the triage done and allow them that freedom to talk and just make them feel like they're actually being heard as opposed to rushing through that because you got a lobby full of people. I just kind of said, you know what, let me slow down when I got you here. And then we can pick up the pace in between and slow down when I got this other one. And just being able to communicate with them saying, okay, look, this is your triage process. We're going to get this blood. Tell them the things that are happening behind the scenes so that when they sitting out there, they don't feel like we just pushed them back out there again. So that was my lesson for me.
I like that.
Yeah, that's a good lesson. I always try to, whenever I in triage and I have a patient, I always try to like look what the doctor order, and I always go down the list. Hey, this is what I'm going to do. I'm going to get your blood. I'm going to give you this medicine or whatnot. You're going to go back to the lobby. The doctor order CT, X-ray, whatnot. They will be calling you for either of these. If a room comes available first, they're going to call you. Just make sure you're listening for your name. This may take some time, but just know if something comes back on your lab or any one of your testing, we didn't forget about you. Just hold on, be patient. You know,
it goes a long way.
It goes a long way, and that way they're in the mental state to be like, shit, I'm gonna be here all day, so let me just cancel all plans.
Yeah, for sure.
So I try not to make the patients that I touch on be mad about that. If they're mad, it's not about because they don't know what's going on, because I'm taking the time. So I'm glad, it's good that you say that and you realize that. For me, I didn't have an eventful shift, but kind of similar to what you say, slow down. But for me, I feel like, and I do this in my personal life too, like I need to learn how to listen. Like I listen, I'm hearing you, but I'm not giving, like I would jump and finish your statement before you're even done, like interrupt you, and because in my head, and I don't know, and it's worse when I don't take my Adderall, because my ADHD is just like always, my brain be going 100 miles per hour, so I'll be finishing a statement and that's not even what you're talking about. So I'll be doing this in my personal life. I'll be having a conversation with you and I just cut you off mid-sentence and be like, yeah, you were already talking about something, now I'm talking about something else, like, oh, the spotlight's on me, you know what I mean? And I don't want to be that person. And even with my patients, like they be asking me questions, and because I'm not I'm listening, but I'm not, I don't know what's going on in my brain, but I'll be cutting them off mid-sentence and saying something that's, one guy said, well, okay, that's not what I was going to say, but you know what I mean? So, and I felt bad because I'm like, now he don't want to tell me what he was going to say because I already interrupt his thoughts, and you know, because I won't fucking listen, you know.
That makes sense.
So I just need to listen. I'm okay on my meds, but I fucking hate taking them. You know. So, but I just need to learn how to listen
and slow down.
And slow down.
Okay.
As long as you
and
learn
go to the
and
gym.
I have a gym.
Well, he goes to
We
the
put
gym.
all three of them in there together.
We need to listen, slow down, and go to the gym. Okay.
Yeah, I'm scared to go to the gym, though, to be honest. I'll be like, I wonder if they're going to be like, what is her little ass in here doing? And I'll be like, just mind your business.
Are you going to get a trainer?
I don't know. I'm just going to start going.
Okay.
I'm going to make that my business starting on Friday. It's just go.
Yeah, it's not happening on Friday, but okay.
Well, I go to work on Friday. It's right after
You go
job.
before or after?
After, because I get off at 7 a.m.
Oh, at the wellness.
It just be so many people, but it be lit in there. It be lit.
That would be no for me.
It be lit.
That's too many. I already deal with enough people.
It doesn't mean that many people, though, but it's quite a bit of people, about 7 a.m. It is quite a bit of people.
What time your shift start?
7:30 is when I get off. I work nights.
Okay. Oh.
Yeah.
Okay.
Yeah.
Okay, so recap. We talk about
The
new
grads.
nurses and new grads and their support. If you would have one thing to say to a new grad today, Isis, what would you say to them?
Keep going, no matter how hard it gets. It's gonna be hard. You're gonna have your good days, your bad days, your all right days, but get through that first at least 2 years, year to two.
Yep. By you, Donna.
I would just tell you, don't take anything personal. Don't worry about what people think about what you're doing. Don't worry about anybody else's feelings about how you did what you did, as long as you did it safely and right. And always write down what you don't understand so you can go back and read it or learn it.
Yeah.
Yep. Well, me, I want to tell you all that nursing is not just a paycheck.
Nope.
It's one of the hardest jobs you will ever love. And that's it.
I like
you know?
that.
Yep.
So
It is.
take it day by day. It will come. Trust me. Don't compare yourself to nurses that are been there from Nightingale days.
Shut up.
Yeah.
Nightingale's crazy.
You're new. Ask question. Slow down. and it'll come. Just give it time. That's it.
And you will become a nurse one shift after another.
One shift after another. Well, thanks again, guys, for joining us for another episode of Talk Your Shift. I'm Will.
I'm Donna.
I'm Isis.
Like,
Subscribe,
and share.
see you next week.